Alrighty, our recording is underway. We're going to go ahead and get started. Good morning, everyone, and welcome to the Spring 2023 meeting of the Human Services Advocacy Network. My name is William Tarter Jr., and I'm a fellow here at the Center for Community Solutions, and I'd like to welcome all of you to today's event. Today's conversation is focused on the role of settlement houses. Settlement houses have a long and established history in the United States, and especially here in Cleveland. Today, we will hear from the leaders of several different settlement houses, in particular from Black leaders who are leading their organizations in tackling issues related to racial disparities that continue to impact communities and the way of life of Cleveland's residents. Moderated by the Senior Fellow of Community and Racial Equity, Zoma Zabala, today's panel will explore the history of these organizations, how they adapted to the most disruptive pandemic in over a century, and how they are poised to move forward into the future. A few housekeeping notes: please keep your microphones on mute. This forum is being recorded, and a copy of the recording will be available on the Community Solutions website. The hashtag for today's event is HSAN. Questions can be submitted in the chat box, and we will try and work some of those questions into the program. It is now my pleasure to turn it over to my colleague, the Senior Fellow of Community and Racial Equity at the Center for Community Solutions, Zoma Zabala, who will introduce our panelists and begin today's program.
Oh, good morning, buenos dias, everyone. This is an exciting morning for me because I have some good colleagues who are going to tell us about all the amazing work they've been doing in our communities. So I'll get right to introducing our first panelist, Mr. Lovell Custard, who has served in a variety of management and leadership positions. And after 8 years as the Executive Vice President of Murtis Human Services System, Custard was appointed to the post of President and CEO in 2010. He leads a dynamic human services organization that provides behavioral health, addiction, youth, family, residential, and senior services through 12 locations to over 12,000 individuals across Cuyahoga County. Welcome, Lovell. We also have panelists, Rachelle Milner, who became the Executive Director of Westside Community House in 2018 after managing its family services program for over a decade. Today, the program services over 1,500 families in crisis each year, aiming to reduce system connectivity and reunification of families. The organization now, in her leadership, has fostered a closer connection between model family program and all other programs servicing seniors, youth, and the community at large. Welcome, Rachelle. And finally, one of my favorite people in the city, panelist Atunyese Herron, is a dynamic, hands-on nonprofit executive with a wealth of knowledge and experience delivering reliable results that benefit community and nonprofit organizations. She has built and led talented teams of professionals through interactive training and mentorship programs. And now, since 2022, services as the President and CEO for East End Neighborhood House, a 115-year-old settlement house and family resource center on the east side of Cleveland that promotes continual well-being of the family and the community at large. Welcome today. So we are going to jump right in. Now, since I've been in Cleveland, you all know I am originally from Newark, New Jersey. And since I've been in Cleveland, been honored to know these amazing settlement houses, which I consider to be the gems of the city and county. And so today we are going to have a wonderful dialogue with you. And I'll start by asking, from any of you, who would like to tell the audience, if they don't know, what are settlement houses? What are they doing today? But what are they?
Sure, I will start out. Good morning, Zoma and Atunyese and Rachelle. So when we think of the term settlement house, we think of the history of the movement that goes back well over 100 years and started in England and made its way to New York and Cleveland, Chicago, and LA. And we think of it as an institution that helps families and individuals essentially settle, typically from one neighborhood to another, or from one locale to another. So when you think of the Great Migration here in the U.S. in terms of African Americans moving from the South to the North, you think about settlement. You think about that whole process of becoming accustomed to a new community, establishing that bond that makes community. And, so the whole issue of settlement can really tie around not just migration and at one point immigration, but it also deals with settling into a new way of life. So there was another, if we want to call it a sort of a micro settlement movement, and that was from the mental health perspective, when there was deinstitutionalization and individuals were being so-called insane asylums or psychiatric institutions, hospitals were essentially disbanded early 40, 50 years ago. There was a process of individuals needing to settle out in the community, individuals needing to find a way to live. So and what those connections are. And so it was a process there tied around, a common bond. But that common bond could be a variety of things. And essentially that whole issue of settling. I know we have East End on the call, and East End is probably one of the oldest settlement houses in Cleveland, if not the U.S. And there was a lot of immigration settlement going on at that time. Murtis has only been around 75 years, and our settlement process was primarily migration. The Mount Pleasant neighborhood was a predominantly Irish, Italian, and Jewish neighborhood that quickly began to change and see an influx of African Americans moving into the community. So as Black folks moved in, there was a need to deal with disenfranchisement. There was a need to establish or create access to institutions that were technically here and available in the community, but weren't accessible, if you will, the same way they were accessible for other individuals of other ethnicities and races.
That's good. That's good. Anyone else want to chime in about their shop?
Yeah, well, I want to piggyback on Lovell, and good morning to everyone out there, Rachelle and Zuma and Lovell. As Lovell stated, East End Neighborhood House actually was settled by two Hungarian sisters back in 1907. So they were actually, to the point of immigration, the area at the time, the Woodland Buckeye neighborhood was Hungarian, of a Hungarian descent. So a lot of those families that came to the United States settled in that area. And so the two sisters formed the East End Neighborhood House to help those families with all types of activities, learning about the community, helping women with classes of sewing and teaching, childcare, helping the seniors in the neighborhood. And literally from 1907 to 1922, they serviced around 70,000 families from that time span. And so we are one of the original settlement houses in the area. And we actually are one of probably the only settlement houses that actually is still operating from the house. The house actually still stands. And so our institution is literally in the house that was founded by them. And the history is so vast because it actually was, the building itself was the summer home in 1910 for the Van Swergen brothers. And if you know who the Van Swergens were, they're the ones who built Tower City in downtown Cleveland. So if you go to the top of our house on the 3rd floor, you have a beautiful view of Tower City directly ahead of you and the Lake Erie. So, and they built most of Shaker Heights, you know, if those who don't know. So the history is vast in Cleveland of the settlement house music, the immigrant movement and everything. And then of course, as Lovell stated, then it became the Great Migration of our ancestors, our people of color moving from the South to the North. So they came up to Cleveland, to the Mount Pleasant, to the Buckeye, to the, you know, to all the neighborhoods that are predominantly Black today from that migration. So we still are working in the house that was founded on the settlement house movement. And now we are still helping in the community in that house. And we are enjoying it every day.
There it is. There it is. Rachelle,
That is so
thank
good.
you.
Yes, yes. Woo, that's so good. And this is so invigorating. So you guys, I'm excited. Just bear with me. But the thing that I would like to add to this is in my preparation, I was just kind of looking at the history of the settlement houses here. And as my colleagues alluded to, it's just responding to the needs of the settlers. Just to take a little walk down some of the other settlement houses that aren't represented here. You had Hiram House, who some college students rented a house on the near West Side. Who knew that, right? And began as a kindergarten and education classes. Rainey Institute started out providing physical and industrial training. I never would have thought about that because all I think about is production, music, plays, singing, and dancing. Friendly Inn Settlement House started off as actually 3 inns. And then the central place, which is what we know as Friendly Inn today, was the place where they started off providing a reading room that offered, and then they offered room and board. So they were responding to the needs of the people going to work, seeing the children that needed to be occupied, and then providing those services to them. Altar House opened a nursery in a small cottage to support mothers in Little Italy that worked in the vineyards. So you can see that the settlement houses, we start from the ground up. People came to the community, they saw the needs, they had the heart to do the work, rolled up their sleeves and got to it. And so just as my colleagues have mentioned, Westside Community House, we are in that deep history as well, providing beginning with services for youth, a day center for youth. Founded on the foundation of the United Methodist Church and the deaconess women who went out to visit the sick and help people obtain work. And then what they identified in Ohio City at that time was the need for childcare services. So that is a service that has been with us from 1890 until today.
Very good. Yeah, very good. I think actually Friendly Inn may be the oldest locally, if it's not higher, but I think it's Friendly Inn, if I'm
Yeah, because
correct.
I think they're over 120. I think they're
Yeah,
over 120 years old.
They're definitely, yeah. We will be sharing actually a list with our listeners today of all of these wonderful organizations so that you can continue to get to know them and perhaps even build collaborations with them. So look forward to receiving that. You know, what I want to go into next is the fact that, you know, you were very selectively picked by me to do this panel. You know, there's so many of you in the city, but I picked you 3 specifically because I see you as sort of the next wave generation that have been leading these settlement houses. A lot of our leaders have actually been long-term. I know before Atunyese and before my little stint at East End, you know, that person left for 30 years, Paul Hill Jr. And so you 3 sort of represent that sort of next generation of leadership. Also, your neighborhoods, you know, as we stated in the title of this panel, is representative of some of the most marginalized, if you will, and communities that are facing great disparities. You know, just collectively between you all 3, anywhere between 60 to 40% of the children in these neighborhoods are living under poverty. And so you are facing consistently many challenges in the services and the work that you do. And so I want to ask next, if you could tell us a little bit about what it has been like with the pandemic facing COVID, how did it affect your services, your funding, your outreach, whatever you like to share. Because I think that one of the things that I definitely want to elevate to our audience today is that while many people got to go home and lock up and protect themselves, you all were on the ground still servicing community. And that needs to really be highlighted, honestly, because without you, there wouldn't be, a lot of people wouldn't have been able to receive the services that I know you all delivered during this time and still today. So if you could, any of you again, speak to this time period and how you handle and how it affected your organizations.
Sure, I'll start again. Again, this is Lovell, Murtis Taylor Human Services. I think I want to start by thanking the funding community, because the funding community, United Way and the Cleveland Foundation, as well as Cuyahoga County, the city of Cleveland, and through, federal efforts, made available, funding and made it available rapidly that was, necessary in order to meet the needs that were being expressed as the pandemic began. When I think of the impact of the pandemic, I think of the fact that it has forced us to speed everything up. It has forced us to be more innovative, and it has forced us to focus on meeting individuals where they are, and getting out of our normal mode of operating, and how that makes its way. When Murtis Taylor Howard Mills, our founder, began our organization in 1948, some 75 years ago, the first thing she did was she went door to door and did a needs assessment. And we have, focused our work on needs assessments ever since. And essentially, prior to the pandemic, if you think of, say, the 20 years prior to the pandemic, from 2000 to 2020, every 5 years we would do a series of needs assessments. And because we were in multiple locations, we would identify various communities that spanned across the multiple locations, and we would go out and talk to people and find out what are the needs. And we would base our fundraising, our focus on funding, our programming on what we, heard from the people. When COVID hit, we were just about to start a needs assessment. And we didn't have the luxury to be academic and to, spend 6 months, canvassing the community, talking to people, writing it up, securing a PhD somewhere to analyze it. Instead, we had to look at every single day as people called in, as people talked to us. We had to make adjustments on the fly. You need this, okay, let's find the funding for it. And so we communicated with our partners, and many of these partners aren't just the funders, but these partners are, Westside Community House, East End, Friendly, and CMHA, organizations that deliver things that we don't deliver, but the need is there. And so there were no boundaries. There were no barriers. It was simply, I've got a family, here's the need, let's make it happen, we'll sort it all out later. So we became very innovative. And, just like every other industry, a lot of services moved to remote. And a lot of services moved to virtual video conferencing. Services, our employees, in order to keep them safe in that first year, worked directly from home. But they still put a mask on, and they still went to homes, knocked on doors. They delivered food. They did all of the face-to-face first responder work that was necessary. But we did adjust. We adjusted by, remote working, eliminating office work, changing how we deliver services and where the services are delivered. We reduced the number of physical facilities. And as we think about how that's impacting us now, that's still having an impact as we figure out how does this all sort out, because we're still feeling the impact, some positive, but some more, not necessarily negative, but burdensome. So there are some impacts of COVID that are still burdening our ability to deliver services, and we're trying to, make that adjustment. So it's been, innovation. It's been reacting. We still haven't done the needs assessment, and we're going to get back to that formal process because we believe there's value to it. But right now, our needs assessment is almost every day. Every time somebody picks up the phone and calls us or walks into our facility, we are making that assessment and saying, well, how many people this week, asked for this? Do we need to deliver this? Can we deliver this? So we're delivering services that we never delivered before. And we're not getting, at one point they were funded. Now we're getting to a point where the burden impacts us because we're not being funded to deliver those services any longer, but we still see the need. And so we're trying to adjust. We're trying to figure out, continue the funding efforts. How do we continue bringing the resources in to continue meeting these needs that we're seeing in this very hyper responsive period? So we've become very reactive. And I used to think that word is negative. Always be proactive, do your assessment, and then decide what you're going to deliver over the next year, next 5 years. Reactive is not a negative word.
Right.
It is us responding to the needs in the immediate time that our families have and that our workers have. And a big part of what we've had to do is work to keep our workers safe. And and I'm going to give time for my colleagues to talk, but the impact of this, one major impact has been workforce. There's so many individuals that have left the industry, whether we're talking about family service workers, whether we're talking about treatment workers, individuals working with seniors. They basically, have reached a breaking point in terms of burnout, and they've decided, I'm going to go to retail. We used to think retail was the hardest thing in the world, and I run into them all the time, and it is a matter of the psychological impact on the workforce has been so intense over these last 3 years that the workforce has really shifted and changed. And just like other professions, we have a huge need to fill, positions and to deliver services. So everybody who has remained is working very hard, is doing double duties. And as, individuals have left, in our supervisory ranks, we've picked it up. I'm probably doing 4 jobs right now as we speak, and have been doing for the last year, simply because I can't find the people to fill the positions. So.
Wow, powerful stuff, real stuff. Atunyese or Rachelle, want to chime in?
Rachelle. Go ahead, Rachelle.
Sure. I'm over here nodding because Lovell, you hit the nail on the head. We went through an international pandemic, but it was also an international crisis. And I think it was a time where it doesn't matter where you're from, where you grew up, ethnicity, race, or anything, we all were impacted. And the psychological impact on the workforce is something that we're really, really experiencing as well. We went through the pandemic, we made it through. I was just kind of thinking about each year in terms of themes. So 2021, it was like we were thriving. 2022, we were maintaining. 2023, we're exploring. And so for Westside Community House, just like you, Lovell, listen, guys, I was in this job for 1.5 years and then pandemic. So nothing about me reaching out to my predecessor was related to the job that I have. It's a different job. And so, to have 2 departments that were working remote, one, like you stated, Lovell, boots on the ground, delivering meals every day, people working remotely, is just really trying to balance all of that and being connected to all levels of government, all levels of information. I think I was texting everybody, all of you all. We were just so connected because of that crisis. And so now with us finding ourselves on this side, and like I said, in the exploring stage or theme of this year, being a year and a half in, I had all of these things. I want to do this, I want to do that. We're going to do a strategic plan and blah, blah, blah. So now I'm in the place of exploring and building. Westside Community House, we're 132 years old. We have to make sure that we stay relevant. And just as I read the different activities that families engaged with the early settlement workers and different volunteers that had it in their heart, I'm in that place. I wanted to go out and shake hands with people and, you know, do those things. And last summer, I was actually able to just connect with the business owners. And even with that, there's just so much change. So we have to really capitalize on all of the changes that have happened in the community, evaluate where we are, and take the next steps for our services to the seniors, youth, and families that we engage in. So that's what I have to contribute to that.
Mm-hmm.
Well, I'll say before we move on that I think, Lovell, I think you guys said it right, because we were proactive and then we became immediately reactive, because it was immediately what the governor said, right? What the governor said is what was going down, right? But I think for our approach, because I remember it vividly, because the week before the shutdown with the governor, I was on a family vacation in Chicago, and my mother and I were coming back from the airport, and we were looking around and people were like, okay, O'Hare Airport just got shut down and we had just made it to LaGuardia. And we were like, what is going on? What is going on? And we were like, whatever flight was getting to Cleveland, we on it, right? We were on it, because it was literally like reactionary, like what's happening? And literally since we came back, we were in the midst of, I was trying to tell people what we're doing. We were having these weekly meetings, you know, finding out what was happening in their state, where the hot spots were, what was going on. Remember, our state was going from yellow, green to yellow, red to black, you know, where all the spread was happening. And so all that was disseminated information and was just becoming overwhelming. And then at the same time, as we're trying to make it safe for our workers and our families, you know, out in the community, they didn't know what to do. So we literally were reactive to what was going on. And even though the governor had shut us down as what we could do, we immediately never shut our doors. We stayed open. East End stayed open the entire time. We became a pandemic center. I applied for everything that we could do to stay open and to stay open safely. So we made sure, because families were just like, okay, what do I do with my kids? Seniors, like, you know, even though we had to close down our senior center because that was a mandated order, we still touch seniors every day, because I got our staff out in their cars to go touch every senior that we delivered a meal to. Are you okay? What do you need? We talk to them from the street. You know, we say, hey, you guys okay over there? But we still made sure that we were connecting to everybody, because people were just in that whole, like, what is going on mode. And then as time progressed, we just said, hey, we're going to continue to service the community the best we know how, the safe way, to do it safely, but to make sure we didn't lose connection, because that's what a lot of people lost, connection. Our seniors, we lost a lot of seniors during that time because of social isolation, not because of the pandemic, but literally because they missed being around each other. And when we were able to get everybody back in to the center, because remember, 2020 was one thing and it seemed like 2021 was worse. Like, what is happening? We lost more people, you know, it just wouldn't end. So now that we're in 2023 and we're slowly coming back to it, you know, our seniors are so excited, you know, some were afraid to come out. Our children, you know, we had a lot of learning loss with that hybrid learning. So a lot has transitioned during that time. But during the time of the pandemic, we said we are not going to lose connection to our people. So we tried very hard to make sure that we didn't, and we tried very hard to make sure that it was safe and that we were, you know, did it under the auspices of what was mandated by the governor. So, so it was a lot going on. I think, but hey, we're here, right? Because we're resilient, and but we still have a lot to do. Like Lovell said, we still have, you know, to make sure Lovell's doing 4 jobs. I want Lovell to know that us women-led CEOs over here, we're doing 15 jobs, just so you know, Lovell. Okay, because I clearly know. And I want to be very frank out here, very frank. Atunyese Herron has worked for Lovell Custard and for Zuma Zabala, and so they know me. So clearly they know that we doing all kind of work out here.
That's good. That's good. To follow up and stay in that mode, actually to switch it up a little bit. How about you sharing with us, because I think that sometimes what's sort of a blessing in disguise during these challenging times when we are tested, some things sort of emerge as our wins, our specialties, those things that we do really well, right? Sort of maybe really rise up to the top. Any of you would like to highlight what some of those wins or some of those initiatives perhaps that you were driven to start or revamp, or anything that you'd like to highlight about your centers, things that you are doing that are gaining you good outcomes and good results as you wish.
Sure.
Go ahead, Lovell.
We'll switch it up. I'll let you go first. I don't want to monopolize it.
Okay, yeah. I would like to say that prior to the pandemic, we were looking at our youth services department and trying to determine what we were going to do. For the last 12 years, we've provided a program for girls ages 10 to 12 called Sisterhood, which had a summer and a school year component. But just because of the pandemic and with attendance and just transportation and a lot of the things that we had seen, we already knew that a younger population was a definite need that we should have been engaging with, girls and boys. So this summer, we are going to roll out a program for girls and boys aged 8 to 12. And this is big because for me, I worked at the agency back when we had this service, but it's my first time rolling out with this. I know just from working, with the schools and doing this work with the youth, that this is a very niche community for us to work with. And so we're going to pilot it this summer. That's one thing that I'm really excited about, because I feel like my pre-pandemic new executive director self gets to jump to the future and kind of move forward with some of those plans that we wanted to do. Another thing for us is that over the years, we could forecast the changing demographic of our healthy aging population, our older adults. And so for us, we have a lot of participants who come from group home settings. And so when you think about the greatest generation, which I think the oldest person in that generation is like 98, we actually have a 97-year-old who just this last week celebrated her birthday. But the population is changing. It looks a lot younger. We have people with more mental health diagnoses and cognitive delay and et cetera. And so the fact that we knew this and were anticipating it, what it has caused us to do now is really engage with this community. Engage out there and in the house, because we can't, you can't just throw up an activity and expect them to engage all the time. Our staff, we need to train and retrain to say, you have to engage them with bingo. You can't just give them the bingo card and allow them to play, but it's just really getting them up, getting them to move. A lot of them take medications and sometimes they just don't feel like it. Well, if we can go and lock elbows with them and get them to move a little bit, get those endorphins moving, it still provides our Healthy Aging Center participants with a meaningful experience. And so those are some of the things and ways that we have zeroed in to make sure that, once again, we're looking at the needs and doing it from the ground up.
That's good. That's really, really good. Atunyese or Lovell?
Sure. So when I think of, what has come out of this crisis that has, transformed our agency the most, I think of a process of providing better access for services. So, there's a tendency in our industry to think of, either a person is in crisis or a person is not in crisis, and there's no in between. And what we found during the pandemic, and what we're continuing to see is that, there is an in between, and then there's this emergent, really important need to access services. It hasn't gone to a 911 or a 988 level yet. The person's not in crisis. No one's actually going to die. However, in the next week or so, in the next 30 days, a potential negative outcome is potentially out there, whether that is the person becoming homeless, the person to the point where they, don't have sufficient food. And so we created something called Care Access Now, which is a structure in a system. There's a phone number, 283, area code 216-283-4400, option 5. And that will put you in touch with an access worker. And that access worker's focus is to, conduct a screening, identify, is this a 988 call? Is this a 911 call? And we, don't see ourselves as a crisis line. We see ourselves as an access line, and specifically an access to the services that we offer. And so what we've done is we've created a single gateway into any of our services, whether they be child care, senior services, family preservation, substance use disorder treatment, mental health services. By calling that number, we can connect you. And more importantly, or just as importantly, we can also put you on the line with one of our partner organizations, whether that's Westside Community House, East End, or using 211. And so when individuals funnel to us because they're in a situation where they're about to lose their home, they're in a situation where they haven't eaten in a couple days and things are really getting rough, they're in a situation where they're hearing voices. When they call that line, our trained access workers are able to make that assessment, connect them to the appropriate person, internally or externally. So it's really creating a system, and we saw this as a huge need because, very few people were knocking on our doors during the pandemic, but they were all calling. They were all, trying to access service, trying to figure out where do I go for this, that, or another. And so we created a structure out of that, and we formalized it, we secured funding, and we've moved forward to sort of meet this emergent, not crisis, and not, every day just, hey, I need a service, but, something's going on, and it's serious to me, and I need help. So it's a behavioral help, it's a human service help, it's a community service helpline for individuals to access services.
Good.
No, that's awesome. That is awesome.
Awesome.
I think the major win for us is just continuing the service delivery. I think because of all the things that we've gone through, I think as Lovell stated when we first started, is that the philanthropic and the foundation community saw the need that was there in the community and filtered in additional money to help us maintain and to help us continue services, because it was coming at us so fast and we didn't know how to support what was happening. So there was that need. And so to continue the service delivery, and I also stated literally as one of our top initiatives is to increase our access to child care mental health. That's a win for us because the need was so great with the children having so much, children are resilient. We clearly know that. However, that time frame from 2020 till now, that whole hybrid learning fiasco that we did, we were in it and doing it. However, it literally caused children to lose so much of socialization, education, all the isms, right? And so children are hurt now because of how much they lost. There's been statistic after statistic, study after study of the learning loss that has happened, and children are not reading at the grade level. So I think for us is the win has been the maintaining of service delivery and the focus on East End and the focus on our organizations that we are in the community, helping the people in the community. So I think for us, it's been a bigger focus from the philanthropic side, which I'm not saying we didn't have it, but now there's more keen eye focus on us now. You know what I'm saying? So they are seeing, oh, okay, well, you guys were out here doing the work. So let's see how we can assist you to continue doing that work. And I'm not sure if it was that same way pre-pandemic, but I think the focus is there. So that's been a huge win. And also to addition what Rachelle was saying with our wisdom keepers, who's our affectionate terminology at East End, are our seniors, they are our greatest generation. And we do same thing. We have seniors who have been here with us for 20 years, from when they were 70 and they're now 90. And that whole thing of we want to make sure that we continue to come and continue to be open. So we're doing more intense things with them. Like you said, Rachelle, not just the regular bingo that you're used to, but it's bingo on the go. It's more exercise, it's more cognitive stuff. So it's not so that they're sedentary. It's so that we can, so it actually helped us. So that's a big win of seeing the things that we could do differently, because during the pandemic, it was one thing. And so now we are continuing those things that we didn't do before. So the reach in is much greater for us. So that's been a big.
Admirable. Just
Hey,
absolutely admirable. Go ahead, Rachelle.
Really quickly, I would be
Sure.
remiss if I did not mention the community-based services programs that we all, the representatives here today, that we collectively do this work in partnership with the Department of Children and Family
Oh,
Services.
of course.
With families who have open cases as well as prevention. We've been doing this work over 20 years, and we remained connected through the pandemic to continue in the work. There are 9 organizations that provide this, and we service all of Cuyahoga County. And so that's something that I would like to say that we held in the work, continuing to be in those team decision meetings with the families. Once we were able to open up our sites for visitation, some sites use discretion, but we were open. We were here for the families, still attending the meetings via Teams, but making sure that we're connecting with those families and giving them the resources that they need. And so I would be totally remiss if I did not mention that as well.
No, that's I'm so glad that you brought that up. And for those of you who don't know, the collective of organizations that do that work, in fact, involve many settlement houses. It involves some other organizations, but many settlement houses that I know also operate under the auspices of a long-term network of the Council of Neighborhood Leaders. So if you don't know, you should know that they lead collaboratives across the county where they actually pull a network of different providers per neighborhood, where they sort of increase that bag of resources. So if we don't have it at East End, maybe someone else has it, and we're working as a network. So these are very powerful collaboratives in each of these neighborhoods led by these organizations that you're seeing here today. So again, if you don't know, you should know and find out how you can be part of that network to be in support. Along those lines, can you tell me, or can you speak a little bit about what might be, after everything that you've gone through, some of the things that you've highlighted, what do you see in your minds and what you see every day as some of the most primary challenges that are affecting our families, our communities in your neighborhoods? Anything that you want to sort of highlight, like, listen, we need to pay attention to this. I know that we talked a lot about, the internet connections, and the challenges that we face with that. Is there anything else, or in addition to something like that, that you want to highlight today?
I'm going to keep the focus on access
Okay.
and frame it this way. Many of our challenges is the access period, access to affordable housing. Housing costs are ridiculous, right? So just access to getting affordable housing. What does that mean? Access to childcare. We offer childcare, but many of our families don't know how to obtain vouchers. They don't know how to talk to the county. They not all necessarily have a case with the county. They just want to make sure they have access to care. And so how do they get that? Access to food. That has been a huge thing for us. We normally service food pantry for our wisdom keepers, our seniors, but it's been access to food for all of our families. All of our families has been in need of food voucher, where do I go? What do I need? So that list continues to get long, and anything related to that, hygiene, support, vouchers. So, and then I think the whole thing, because the nation's economy now, due to inflation, has caused everything to skyrise. Remember we had I'm sorry, my clock is going off. When we had the gas hikes and all that. So all these things, I think for us, is just access to care and to ensure that our families know where to go to get things to access.
That's good. That's good. Anything else, Rachelle or Lovell, you might want to highlight?
I agree. She hit the nail on the head for every bullet point I had. And especially, that's how queens do. Yes. But the West Side is unique, and especially for us for housing, because it's so diverse. It's people don't like the G word, but I'm going to say it's gentrification happening, and it's coming further west. In 2006, we moved from Ohio City because we saw families moving further west. And so like my colleague has stated, it's access to all of these different things. And we find people in housing, they just don't know, they don't understand. The goalpost changes. Today is this, tomorrow is that. Pay $100, but the house is already rented. It's just so many different things. So we're just really wanting to re-educate ourselves on these moving goalposts, because that's our role, being those advocates, you know, sitting on the side of right so that we can help our participants. So thanks, Queen.
Very good, very good. Lovell?
Yes, we're headed for a perfect storm, and we're almost there. And this perfect storm, you know, ties to our current workforce system and the situation as to where settlement houses and providers in general are in terms of having staff to actually deliver the services. So, you know, we're all understaffed. We're, you know, headed into a funding cliff. We're at the edge of that funding cliff because there was, you know, a significant amount of resources, you know, pushed into the system. I'm talking system-wide. We're pushed into the system, and that funding is all but gone now. And now, May 11th, where the emergency, a federal emergency declaration will be lifted, and county departments of Job and Family Services across the nation, in Ohio in particularly, are moving toward requiring individuals to redetermine their status, which impacts food stamps, which impacts housing, which impacts treatment services. Felt a sneeze going on there. I didn't want to sneeze on camera. And so, you know, we have a workforce shortage. We're at a funding cliff, and the demand is about to explode come May. And we're already seeing that uptick in demand. And this perfect storm is going to cause a considerable amount of a series of challenges for institutions and for families trying to figure out how do they feed, you know, how do they eat, how do they stay in their homes, and how do they receive services, whether we're talking mental health services, which are, you know, hugely in need now, or primary care services. And, you know, a lot of the old data, you know, the data was never perfect in these systems, meaning that, you know, a provider needing to, or a family needing to complete redetermination in terms of the eligibility for public services, you know, would receive a phone call or would receive a letter in the mail. And that was always hit and miss because of individuals, you know, housing situations were oftentimes volatile. And it's even more now. The names and addresses and phone numbers that are on records with respect to public assistance, it's pre-2020. It's not accurate stuff. And you know, the process that has already begun in Cuyahoga County in the state of Ohio, and probably across the nation, is to send a letter out to an individual to say, hey, it's time to, you know, if you are, you know, want to keep your benefits, you need to go through a redetermination process. Those letters aren't finding people's eyes. And even in situations where they would historically find a portion of those individuals, you had to deal with whether or not the individuals fully understood, you know, what it meant, whether or not the literacy level was there. And so now you've got literacy, you've got, you know, the focus on other priorities, and the fact that the letters are going out to addresses that, you know, are no longer the domiciles of where, you know, our families, you know, currently live. And we don't have the workforce to sit down with everybody who walks in the door and say, by the way, have you completed your redetermination? Let me look it up for you. We just don't have the ability to do that. And what we're seeing is cuts. We're seeing and county, city, state. We're seeing funding ending, and that's going to be a huge challenge as we move forward with this perfect storm.
Wow. Powerful stuff, guys. It leads me into, and I just have two more questions for the audience. Please get your questions ready. We will be taking them in the chat area. So if you have any questions for our panelists, start formulating those and putting them in the chat so that we can ask those. But two more questions. One being, I've seen firsthand, the power of collaboration and partnership between you all as organizations in the neighborhood, the way you support each other, the way you fill in the gaps, for one another. So I'm going to ask you to take this opportunity to tell the audience and tell our county members and everyone involved, what are ways that we can provide support to you? Systemically, funding, partnerships, whatever it is that you feel might be helpful, especially after Lovell so eloquently explained what we're about to face. So what can people do? What can community do? What can leaders do to be of support to the work that you all do in our neighborhoods?
I will take off where I start up where I ended. Those who have influence and control over, funding, whether that be foundations, United Way, or government funding, focus on providing funding for services, for operations. ARPA money is fantastic. The vast, because of the tight funding constraints, it's capital, it's short term. I know there's some differences there, and we are accessing those dollars, and we're appreciative of those dollars. But if you have influence and control over funding, or advocate for funding, funding with respect to operations and service delivery is huge. A real simple one. If you know someone who is interested in working in the helping profession, if they're just about to start their secondary education process, encourage them to explore social work, counseling, gerontology, their field. If you know of someone who is interested in changing fields and wants to work in a dynamic organization that helps others, dial, and Atunyese, I'll let you say your number, and Rachelle, I'll let you say your number, but for Murtis Taylor, dial 283-4400, extension 2296, and leave a voicemail. Tell me you're interested. I'll make sure that we get that funneled to the right person, and that our available positions are made clear. You can also contact us on the web, and that would be murtistaylor.org, and go to careers and apply directly on the web, or Indeed. We also use Indeed for applicants. So, helping us with the workforce, helping us when it comes to funding. And then also, if you know of someone who needs assistance, encourage them to seek that assistance sooner than later. Encourage them to dial 211, first call for help. Encourage them not to put it off, because it's less expensive, it's less of a burden for us to address an issue early on than to wait until that issue becomes, a crisis. If you know of a senior who needs a meal, if you know of a person who needs mental health services, you can go onto our website, murtistaylor.org. You can go to 211. You can go to East End's website, Westside Community House's website, and encourage them to seek those services out sooner than later.
That's good. That's good. Atunyese, Rachelle.
I was responding in the chat. I agree. What Lovell was stating, that it's just like I said, the pinpointing of foundational, philanthropic, and just community support of what we do, because those things are coming. We do know we had wins, but we do know, as he stated, that there is going to be an uptick in demand because of the mandates that's coming down, that those services will end, of the extra food stamps and the additional this and additional that. So we do know that the demand is going to be great. But we're, we're still churning, we're still open, and we're still wanting to maintain what we have. So service delivery for us is important, maintaining that, and just being there on the front line to help those that are in need. I did put, as Lovell stated, calling our phone line 216-791-9378 if you are interested. We do have childcare positions open, and any additional workforce that we would have, we try to put it out there. But like you said, people left this industry. They did leave because of the demand was so hard, and the burnout was real, because of just the nature of this work, of social work, how we, deal things on the social aspect. And it was hard for a lot of people. But for those people that are now saying, hey, I really want to come out and help. And I will say that for us, we changed our pay dynamic. We're a small institution. We're not a very big, large organization, but I did look at, how we can maintain the people that we do have, right? And seeking out what else others were paying for those positions. So I was able to make adjustments for that, because that is one thing that, out here, a lot of people don't want to do these jobs because the pay is so small. So, but to be honest, that's not why we do it, right? Because if we were all in it for the pay, neither one of us would be sitting in this on this call. Right. but that's real for people, just to contrast. So I made adjustments so that way we could compete and be competitive in the workforce of dealing with our seniors, our children, our child welfare department, and all that. So if you're seeking, if you're out there thinking about wanting to come back to do social services in the settlement house, we are here for you. And we do work together. All this that you see, those that are on the call, we literally collaboratively work together. Lovell will pick up the phone and call me for something. I can pick up the phone and call Rachelle for something. We really do talk to one another. It's not a facade what you see. We literally work together collaboratively, because he does mental health. I don't do mental health. But if there's something else that happens, and I have somebody who moved from Buckeye and moved over to Westside, my team is going to call Rachelle's team and say, hey, this client moved over here, you help. So we do talk to one another. So that is real. I think that's one of the great things that we have in Cleveland and Cuyahoga County, that our collective impact together, we do work together.
Powerful. Absolutely. Absolutely powerful. I agree. Rachelle?
Yes. This is so good. So I just want to echo the statements on funding. Yes, everything that was mentioned, I totally am in agreement with. Funding for operations is very hard, and specifically for settlement houses and those of us that are operating independently. We're small shops. We can't afford it when the funders are late with payments and all of this. So we're like doing all the things and
Say
moving
it again.
For the people in the back now.
The people in the back.
We're gonna behave, guys. We trying hard. We trying really hard. We try hard. But it is so important, and it means so much. So we look forward to opportunities to engage with the funding community, to be able to express what the needs are for the little guys, so that we can have our needs met as well in the funding cycles. Regarding staffing, I echo that as well. We have vacant positions, and I wrote that down, what you said, Lovell. The psychology of the workforce is something. You can write an article on that or something. I don't know if you read it or got it from somewhere, but that is something that is so big, and it's really
thinking the same thing.
Yeah, it's very good. Yeah. I think for the participants in this workshop, I think it's good that we've heard this information, and you really kind of get the impact, and you might even be motivated and rejuvenated a little bit. But the thing we need to make sure we do, we wouldn't be settlement house leaders if we did not encourage you to connect. We must lead the charge in literally connecting, whether it's like Atunyese and I have already connected with Julie from Hunger Network, literally in this meeting, and we're going to schedule something to get those hygiene and food products in. We have to make sure that we continue to connect, because for me, that was one thing the pandemic did collectively for all human beings. We wore masks. Everybody was like, oh, do you have COVID? I don't know if I could touch you. Can I, and so we have to make sure that we do it safely, but we maintain the partnerships. We engage with each other, because at the end of the day, even if we have all the money, we still need the relationships and partnerships to be able to help the families that we all touch. Like if we did some kind of geo map, I'm sure several of us have touched the same family. So we have to make sure we connect. Please, let's make sure we do that. The next thing I would like to say is for Westside Community House, we are looking for board members. As I stated, pre-COVID, I was just taking over. So when you have change in leadership, you're gonna have some changes and shifts. We made it through the pandemic, meeting virtually, but we really, really need board members. So anyone that is looking to get involved civically, or if you know someone that's looking to get involved, reach out to me. I will put my information in the chat as well. But I am really, really looking at the direction of the agency for the next 132 years, or at least to the next time they do the strategic plan, right? So that is something that we really have to develop, because for us, we're at a great opportunity. We could get CARF accredited to do this, or it's so many different ways and different things that we can do. And since we have such a rich history, I'm really excited about being involved, being here and a part of that history as the first African-American leader in this place to put the thumbprint on what we're going to do for the families in our community.
Well, speaking about that African-American leadership, another reason why, you all chosen is to really speak to the fact that as, Black leaders in our community, you do face different challenges that some other leaders might, and this is across the nation. So my last question to you before we ask the audience if they have any questions for you is, what do you need personally, you as a leader? What are some of the things that, can be provided to leaders emerging or seasoned to be of support to your leadership and all that you do for our communities? This is not for your client, this is for you, the leader.
Well, I think one of the important self-care elements that is critical in these post-pandemic times is fellowship, and Zoma, our conversations, and Atune and Rachelle, and being able to break bread, talk, discuss challenges, and really sort of have, if you will, some informal therapy around hopefulness, around some strategies to just get through the day. I know folks on this call start their day somewhere around 6, 7 o'clock in the morning, and we're going till 6, 7 o'clock at night. And I'm not sure about you guys, but at probably exactly at 3:45, I am toast. And what I typically do is just pause and reach out to a colleague and have a conversation about how's their day going. And I think that fellowship, and so it's critical that we continue that fellowship. Mentoring never stops. I have mentored and have huge mentors that have reshaped my career, and I continue to call them and I continue to speak to them and talk through, and sometimes it's just about a sports game, March Madness, and then it leads into the job and so forth. So I think that fellowship.
That's good. That's good. Atunyese, Rachelle?
I echo what Lovell has said. Fellowship is so important. Fellowship and self-care. Here's the thing. When you asked the question, we were all like, when do we think about ourselves, right? Like, really?
That's
like,
why
guys, this question was emailed, and I'm even like, I don't know, because we're always pouring. We're always concerned about everybody else. What is the policy manual saying? All these different things, but it gives us that opportunity to not be kind of holding everything together, and we can be vulnerable to those, our people that we trust. We can get insight, we can get information and resources. And this is why for me that connection piece is so important, because you know there's the whole notion of like work besties and all of that. You never know the connections and relationships that we build, like you, Zuma and Atune. You know, there is so much support, and there's people who like get you, and you're like, I don't have to finish my sentence because you get it. You know where I'm coming from. And so that's the biggest thing. I think we need to continue to connect. And I, before all of you, all 71 people on this thing, commit to self-care. Like going to bed on time is such a big thing for me. And sometimes I'm up, and you know, there's that thing that you open your eyes at 3:45 and it's like, oh, you know, did this happen, or did I do this, submit this, or whatever. So going to bed on time for me, I'm shouting it to everyone. So when you see me like, you going to bed on time, you know, that is so important. So those are the things I think for me that are very important.
Good.
I like that, Rachel. I do like that. I think I also like the idea of the informal therapy, because sometimes we need formal therapy. Right? So collectively as a group, we get informal therapy. But I will say, for me, it has been the great connection that I've had with my predecessor, Zuma. And then also teaching, coaching, right? Because during the transition of me becoming CEO, I did obtain a coach. And that was extremely helpful because they have that unbiased lens of just listening. And then if there's something that they want to, you know, if I'm given and they're telling me something, I'm listening to something different. So sometimes, you know, that is a need for people to have a coach, a life coach of sorts, right? And that really helped me in that transition. And I will also say, I remember, and Lovell may not remember this, but I remember when he became CEO and I was in his office and he was like, and it might have been because we did do late nights, like 9 o'clock, like 9, 10 o'clock, like we were up in the morning and we weren't leaving because something was happening. And he was like, I was like, what's going on? What, you know, his face was like glum or whatever. He goes, Atune, it is lonely at the top. And I was like, ooh, I don't want to be where you are. Like, I literally was like, ooh, okay. I'm not trying to do what you do. I literally like looked at him and he was just like, that's it. But I get what he's saying now, because now I'm here, because it stops with you. Whatever happens at East End is coming down to me. So for me, I think it is making sure, like Rachelle had says, that we have those solid connections with our peers. And then just have a strong relationship, you know, outside of that with our family and friends that we can, you know, talk to and dabble at. And sometimes just like now, you know, everybody at my organization knows that all the Atunyese needs is a Pepsi. If you get a Atunyese Pepsi, she gonna be all right, right? So they make sure they bring them. I might drink too many, but that's the way they know that, okay, she's at this high, let me bring her down. So yeah, so I think the informal therapy and being in the fellowship with our peers is important, and maintaining those connections, you know, maintaining those connections. And then, you know, I'm just grateful that we do have a great connection here in Cleveland. Very, very happy for that.
Thank you for that. And now I'm going to let Will chime in just in case we have any questions from the audience for you all.
Thank you so much, Soma. We have had a lot of great conversation in the chat, people posting affirming statements, and just really enjoyed watching the chat during today's conversation. We've had 2 questions coming in the chat and 2 questions coming in via our traditional Q&A box. So I'm going to ask them, and then we will see how much time we have left. So let's get started. The first one is, where do I direct young people between the age of 17 and 24, especially young men, for housing services?
I don't know who does, because we don't do housing,
Okay.
but we would more often refer to CMHA or to housing. Lovell, can you speak to that? Because we would refer our services out because we don't do housing.
Sure. So I would start with United Way 211, and what you're going to find in the current housing landscape right now, it's divided up based on some form of category. So if the housing is because you have a mental health issue, or if you have a substance use disorder, there are housing opportunities related to that. So the question was more blank. It was more, you know, how does any male that age, you know, find housing? And then housing, the rapid housing initiative here in Cleveland and Cuyahoga is based on geography. So in other words, you would, and 211 can link you specifically. If you were to call us, we would, you know, do a warm call with 211 on the line and essentially connect you based on your geography. So if you lived in, say, for instance, the Lakewood area, it might be Lakewood Community Services Center, which is one of the premier organizations when it comes to rapid rehousing. And there are other institutions that, you know, have this in their portfolio. And those are typically geography-based. They typically don't tie to, say, a mental health issue or a substance use disorder issue. It's just primarily where the individual is. Now, if we're talking about a male between that age that has a child and housing is necessary in order to protect that child, in order to make sure that homelessness does not occur, both Murtis Taylor, East End, and Westside have a program called community-based services that that individual male with that child in custody, you know, a male with a child in their custody, could contact us, and we could connect you up with the resources to, you know, make an assessment, you know, bring some prevention services to bear in terms of supporting you with housing.
Excellent, thank you. Another question that we got in the chat is, has ARPA money, which stands for American Rescue Plan Act dollars, helped your settlement houses? If so, how? What were the challenges in securing the monies? And I'm going to take it a step further and say, when those dollars run out, what will be the need and the support to continue the services that were supported by ARPA dollars?
Well, we did receive ARPA dollars, and the application was not as cumbersome as I assumed it to be. It was pretty straightforward of asking what the need was. And so we had operational need and we have capital need. And extremely capital need, because as I stated earlier, that we are actually physically in a house that was built in 1907. So things happen as they do in your own home. With ceilings issues and roofing issues and bathroom issues and all that. So we had a capital need and a operational need. So they funded us for the capital need. And so that was extremely helpful, because obviously we want to keep our doors open, and we can't do it if we can't flush a toilet. I mean, those are crucial things. Service, you know, because most of the times we get program funding and it's a service to program. It is not to take care of the lights on or all that stuff, all the construction, you know, needs of a building. So that was extremely helpful. So we have not tapped into that as yet, because we're going to make that into a capital campaign for us as a starting point for that. So so it was not as cumbersome, because they were literally rolling out the money. It's just that you had to apply for that money, and then we presented at the county council as a team to say thank you and why we needed it and what we were seeking to do with it. And that was extremely helpful. So so far it has not run out, because we just literally received it. And so we're going to make that as a basis to build a greater need for our capital needs, because obviously all these programmings are great, but if you don't have the building to withstand it, it doesn't mean anything. So so we want to continue in that effort to ensure that, you know, to Rachelle's point, that we do another 115 years in the same location.
Thank you so much. All right, we're gonna try and get through these questions as quick as possible, so kind of bear with me. All right, one statement says,
if I could mention,
please.
Our impact with ARPA. So we received through the strategic vision of the governor, DeWine, and through Lori Chris at the Department of Mental Health, a considerable amount of a series of ARPA fundings over the last 12 months, which, you know, have been extremely important to our ability to continue operating. And we are expecting a another sizable ARPA funding. And as Atunyese mentioned, Councilwoman Conwell, Yvonne Conwell of Cleveland City, Cleveland County Council, actually conducted a community forum and talked with community-based organizations such as ours, and listened to us. And we applied for some funding, which she spearheaded, and we were very pleased to receive a significant amount of capital dollars to renovate our facility at 900 East 105th Street. And we are also working with Mayor Bibb's office and City Councilman Kevin Conwell for some matching ARPA funding that is extremely important to finish that project. And so we're very gracious to both Governor DeWine, Mayor Bibb, Yvonne Conwell, Council County member, and Kevin Conwell for that ARPA funding, which it has impacted our ability to operate as well as our ability to improve our capital standing within our facilities.
Thank you so much. This next one is a statement and also a question. It says, what impresses me so much is the culture of caring and commitment to actually help people improve their lives. Does anyone have suggestions how to get government agencies serving the same population to create a similar or the same culture? Too often, these agencies are interested in imposing obstacles rather than creating solutions. So I guess, can you speak to the culture that you have been successfully able to cultivate?
I'll start in somewhat brief. I think that's a tough. It's tough. It's tough for a government agency, a government department, a government building, and government staff to have the same presentation, if you will, that a private community center settlement house has. There's years and years of stigma built up when it comes to government services, and families oftentimes, are reluctant and hesitant about, being completely open, even presenting to a government facility for services, simply because they are fearful based on their past experience. And it's different when you walk into an East End or a Westside Community House or a Murtis Taylor, because they recognize as a community organization, they have history, and they don't have that same stigma and baggage that they have with government institutions. What the Cuyahoga County Department of Child and Family Services has done, and I think it's a phenomenal approach. They've partnered with 10 settlement houses and community-based organizations to provide services, fund services, and deliver county services through some of the work that we do. So in many cases, it's both, one of our social workers in the room with a county worker in the room. And it's sort of, we're lending, if you will, our community perspective, our credibility to overcome some of the stigma and some of the history that government departments tend to have in the community. I'll let Rachelle and Atunyese comment on that.
Additionally, I just would like to add that as a part of the relationship that we do have with Children and Family Services, we're able to interact with the staff in our buildings. And sometimes it's the way we all the time, it's the way we interact with them that does not further perpetuate the bureaucratic mindset or whatever, because we're community. They're the ones that uphold the responsibility of state mandates and rules and all of those things, but we support them in that work. And I literally on last Friday had an opportunity to talk to 3 new DCFS workers. They're in training and they have to do these scavenger hunts. I always take time out of my day and I talk to them. And so for us, it's how we're able to massage a little bit of our culture into them as people, and then hopefully it can just continue to infiltrate the systems.
Thank you so much. I'm going to combine these next couple of questions because they're kind of similar. One, it says, how do you make a lasting difference early in your career in the nonprofit sector? And then the next question was, what advice would you give the upcoming settlement house leaders? What educational background or experiences are needed to lead a settlement house of today?
Well, I'll start again. When I think of, when my career started, and I won't say how many years ago, it was be present. It was, work hard. No job was outside of my job description. If someone needed assistance, if there was a task going undone, no matter what that task is, or was, I would tackle it. And I can remember times of, being up on a roof and unclogging gutters because, it was Christmas Eve and, water was leaking into the facility. I can recall, being under deadline to have so many individuals recruited for a particular program and going door to door myself, and where, I had a fancy title, but I went door to door myself. So it's be present and work hard and don't think in terms of job descriptions. And I actually think if you're interested in this field now, there's a huge amount of opportunity. If you're interested in leadership now, there's a huge amount of opportunity. Leadership roles, line staff, every position, there are openings everywhere in our industry right now. This is the time to get in, work hard and find a new career. This is a time like no other. If you want to, chart a path to become, the executive director in a 5-year time period, jump in. This is the time for it. There are opportunities.
Rachelle, you got something?
Yeah, I would echo that. And I think regarding education, it's an interesting time. I remember when a master's degree was a terminal degree, right? And I really can't say that you need a PhD or XYZ. You really just have to know the organization that you work for and what would be valuable to that organization that you would bring. So for Westside Community House, I have an LISWS that is extremely important and beneficial to this organization. You have to know data, you have to know it. You have to understand it. You have to like it, even if you don't like it. This is the way we are going, and you have to be able to interpret it, not only for yourself, but to be able to communicate to all of your staff that it's not just the executive director's responsibility, but it's everybody's responsibility to be able to understand and interpret it as well for whatever level they're at. And so it's really, like Lovell said, to go above and beyond and just do what's in your heart. It's not about just saying, oh, that's not in my job description and all of that, because like we were discussing earlier, that self-care and everything, we deal with society's problems. The weight comes to our shoulders. So we have to make sure we're doing all of the things to take care of ourselves so we can show up for our families. And I'm gonna stop right there.
No, just to piggyback, I think that is all great. I think to be present and working hard, I think that is a acronym. I will tell you, because I didn't start in this field, social working, all that. I have a business background. I was in the engineering field. I had no interest in what I'm doing at all. None, no interest. It just kind of fell into my lap, right? But when it fell into my lap, as Rachelle said, I wasn't at the top of anything. I was tutoring children. And I was like, oh man, okay, seeing their faces, tutoring children, being in childcare, being in watching the seniors, understanding what it was all about to be in a community setting. And then they grew from there. So it has to be something that you're clearly interested in, because again, I will tell you, this is not the for-profit world of, trying to get all the dings, right? Trying to get all the accolades. But it is something that you can gain a fulfillment from working with families, working with children, working with our in this social world of helping people. And if you are really interested in that, it will come natural to you, right? It will just come natural to you. So I will say, yeah, be present, work hard. And if this field is something that you look for, you do have to get educated in. You don't necessarily have to have the LISWS, which is great for, as her being the CEO, but you do have to have some type of formal education related to, children, social work, or whatever. So, if you're interested, it's a lot available. I do agree with that.
And let me add, when it comes to educational requirements, apply whether you have the education or not. You can get in and do the work. There's opportunities here for you in this industry, in this field, and you can go back to school. As Atunyese mentioned, she started out as an engineer. I started in the industry with an MBA and a finance degree, and went back to train to become a social worker. So you can reinvent yourselves. Test the waters. It's a great opportunity right now.
All right. I think we have time for one more question, and then we'll turn it over to Zoma. This is a question that came in. It says, how can I get a list of settlement houses? How can I get a list?
We're actually going to provide one, Will.
Okay, great.
Yeah, so we worked on one. I guess we'll put it on our website perhaps. But yeah, we actually put a list together. I did not know that Rainey Institute was part of it, so I need to add that. That was news to me today. I thought I knew everything, but know that you don't know. But we will provide one and possibly put it then on our website so that people can have access to it.
And
Okay.
I will tell people, just do history, because a lot of the names of organizations that are in this community are from those that settled, like Mather House. That was from Mrs. Mather. The McGregor Foundation, I forget the lady's name, but Jane Addams, right? People went to Jane Addams School. Jane Addams was a historic settlement house movement. She helped founded the whole house. So all these women
Right.
and men know your history of Cleveland, all right, or Cuyahoga County, because a lot of the names that you see, and we do that for our children too. These kids go to schools that have names and they have no idea what the names mean, who they come from.
Right.
I ask kids, you go to Anton Gradina, they have no idea who that person was. So literally look into and teach the children and teach the families of all these institutions that you go to. They were literally people here, like Murtis. Jerry, there's history to the names of institutions. And so look to that history and you'll learn. So again, not knowing Rainey Institute was one, but if we look at the history of all these things, they all came around about the same time with the people in the neighborhoods who wanted to settle here and who started these wonderful institutions. So we really need to look at the history.
And can I just let you guys know, I got this information from this book. It's called Focus on Neighborhoods. I'll put it in the chat. A History of Responses by Cleveland Settlement Houses and Neighborhood Centers to Changing Human Needs. I think the actual settlement house directors had a hand in writing this history and everything. And so it's so much good stuff in here. And I find myself pulling it out. So I will put this information in the chat.
Thank you, Rachelle.
Awesome.
Thank you.
Shout out to Dawn Colagraph. She was a historian and she really put that in me to make sure that the settlement house history was something that was in my heart as well. So I'll put that in the chat.
Awesome.
That's awesome.
Selma, I have to say that we had over 70 attendees at today's HSAN, which ranks as one of the highest attended HSANs ever. And our chat was just blowing up with comments from organization leaders and longtime advocates as well. So I want to just say thank you to you, Zelma, and also to the panelists. And with that, I will turn over to Zelma to close our event today.
Well, I want to say thank you to all that have joined us today. Thank you to my dear friends and colleagues for life, Atunyese, Lovell, Rachelle. Oh, you guys mean the world to me. I'm so proud of everything that we do in the neighborhood, and you are just amazing leaders. I'm thankful that we were able to elevate the fact that there are some powerful Black leaders in our community doing some amazing things in our neighborhood. They need support. They need you to see them. They need you to support them. Don't miss our next HSAN conversation, which will take place on June 6th. We will be going over the matters of HIV and our seniors, and the network of people that are in support of making sure that we take good care of our seniors. That will be a hybrid event, I hope. But stay in touch with our website. We will also have recording of this show for you on our website so that you can listen again, take good notes. And please, please, please support these folks. They're doing amazing work again. As you all know, I am because we are, therefore I am. It's all about that Ubuntu spirit. Let's be willing to see each other and support one another. Thank you guys so much for being here today. Have a wonderful week.
This was wonderful. Thank you.
Ubuntu, everyone.
Thank you.
Bye, guys.
Bye.